A robot for grandma? Socially assistive robots are providing positive benefits for those showing cognitive decline. I'm Tanya Hall for ZDNet, and joining me is Casey Bennett. He is the Chief Scientific Officer for Raiven Healthcare. Welcome, Casey.
Thanks, Tanya. I'm happy to be here.
What kind of work do you guys do at Raiven Healthcare?
We focus on creating artificial intelligence and robotics for healthcare purposes. Focus a lot, mainly on chronic health, a lot of mental health and stuff like that. Just trying to find a better way to do healthcare, really.
And tell us about your study where you found robots can help reduce depression.
So I have a background in robotics and a PhD in computer science and all that, and then AI. And basically the idea was we put robots, these socially assistive robots, into elderly people's homes who had mental health and comorbid chronic health conditions, diabetes, cardiovascular issues, that kind of stuff. And we were trying to see if, one, the robots would have a positive effect on the people's health symptoms. Could we improve their health via the robots? And two, could we also use the robots, the sensor data on the from the robots, to track people's health over time and make predictions? So it's kind of a twofold thing. And the result of the study, so we put this in homes of elderly people all over the state of Indiana, and dozens of people. What we found was we could improve people's health. We actually found a significant reduction in depression symptoms and other health issues. And at the same time, we actually found the data that we got from the robotic sensors could predict people's health changes before they happened. In other words, these robots are like walking sensor suites, right? They can monitor your, motion, sound, light, what people are doing in their homes, their sleep patterns, activity levels, nutrition. And just by being able to observe that stuff, we could actually see and predict if people were going to get better or get worse in the future before it happened. And so the idea is we can use the robots to improve people's health, but also we can use that information to inform clinicians and say, hey, we think this person is going to get better, if they're going to get worse in the near future, maybe you should, intervene. So that was the idea.
What type of data were you collecting during the study?
So we combine the robots. So the robots, of course, have all these different sensors on them, right? They can collect information about the motion going on in their environment, the light, the sound. You can use that to infer behavioral patterns, right? What people are doing in their homes, right? And how much they're moving around, or how much the quality of sleep, things like that. And we combine those with wearable sensors. So like Fitbits or Nike Jawbones, if you're familiar with those kind of things. And the combination of those different sensors was the basic data set. And we were collecting data every second on these people for a month at a time. So I had a ton of data. It's kind of an Internet of Things kind of idea, really. It's, using all these devices in people's homes to really do something meaningful but health related. So.
Now, this type of technology could help the cognitive awareness in not only seniors, but could it possibly help other people with mental health issues?
Yeah, so one of the other things we're working on right now is a study we're collaborating with my colleagues from Indiana University, where I did my PhD and still work a lot with, and some people from Mississippi State on doing the same thing, but with children who have maybe mental health issues or autistic type issues. And trying to, again, the idea is these are not robots in hospitals or in clinics. The idea is to go outside the clinic walls and put these robots into people's homes, because health, as we all are aware, health isn't something that happens when you go to the hospital or the doctor's office. It's happening every day. And one of the big problems we have right now is the way we think about health is it's this thing that just happens when you get sick. But that's not the way health really works. Health is things that occur to you each and every day, and they sort of accumulate over time, right? The choices you make, your activity levels, all those things, that's that accumulation over time. And so if we can intervene in people's health on an everyday basis, it's a whole different way of sort of thinking about healthcare, and a whole different way of sort of providing healthcare via these robots and sort of the AI technology. So yeah.
So what role does machine learning and artificial intelligence then play in your work, and what kind of platforms, technology platforms and software have you used?
So, I would say it's a twofold answer to that question. With the robotic stuff, obviously we have these streams of data coming off. And so you're trying to make sense of the patterns in those streams and trying to relate those to changes in people's health status. very simple. It's, you kind of pure classification machine learning problem where you're trying to find those patterns in the data and relate them to something meaningful. The other side of that is then also trying to do sort of clinical decision support, right? Try to figure out, this is where the patient is right now, and we want them, they're at point A, and we want to get them to point B in terms of their health, right? Just like GPS, just like driving a car. And the idea is, what's the best route to get them there? So one is sort of monitoring people and be able to track these patterns in the sensor data, but then also, what do you do about it, right? So we know this person's going to get worse. So there's very high likelihood that something's going to go wrong in the next few weeks, right? So, but what do we do about it, right? They're at point A, we want to go point B. There's all these different ways to do it. What's the optimal route? And so it's kind of on both ends. That's really what I work on and what Raiven works on is how do we attack both of those problems? And of course, machine learning is, sort of lies at the root of that, and sort of AI technologies of, the idea again is to provide better information to patients and providers so they can make better choices.
How do you know that the data that you're collecting is the right kind of data that's needed?
You never know quite. I mean, the answer to that question is you never quite know. I think it was an Einstein quote. It was, if we knew what we were doing, it wouldn't be called research, would it? So part of the idea is, it's, you kind of go with your best bet, and you're always kind of working on and improving it and trying to do better. You have validity to the things you do from a statistical standpoint, from an accuracy standpoint, signal analysis, whatever standpoint, but you never quite know if you've got it perfect, and you're always working and striving to improve it and thinking of new ways to do things differently. I think the answer is is probably that we don't, for better or worse. We have a good guess, but we're always trying to figure out better ways to do it. And is that really the right data? And is that really the best way to measure that and that kind of thing?
Healthcare and senior care costs are already out of reach for many. So how is artificial intelligence and other technology going to affect the cost of health and senior care?
I think one of the things I say all the time, and it probably will get me in trouble, but I'm going to say it anyway, is that I think the healthcare in the United States, and probably the rest of the world, but I know, about the United States, the best, we're not going to be able to legislate our way out of it. The Affordable Care Act's a great stride in some ways, but it also has a lot of deficiencies. At the end of the day, the way we pay for healthcare and the way our healthcare system is set up, legislation is just a Band-Aid to put over it. To really solve the problem, we're going to have to innovate our way out of it. And part of that's going to have to be figuring out how we can pay for performance, right? Pay for quality. But the problem is clinicians don't have the tools to help them to do that, right? They don't have tools that tell them what's the best route to go from point A to point B. So if you start paying them for quality without giving them the tools that they need to make the best choices, it's kind of unfair. So it's kind of like we have to have this intersection of technology, this innovation to enable us to do healthcare in a different way. And you're right, senior care, long-term care, nursing home care, with the robots, for instance, one of our big goals is just to keep people out of nursing homes longer, right? To keep people living in their own homes by putting these robots in there, by improving their health status, by providing information to clinicians. Because every 6 months we keep people out of the nursing home, the robot more than pays for itself and saves, costs like $8,000, $10,000 sometimes a month to put somebody in a nursing home, right? A robot costs $4,000. We can keep them out of the nursing home for 6 months. You're talking about a cost savings $25,000 a patient. So there's some very clear ways that we can save money and improve the quality of healthcare at the same time by using these technologies. We just have to figure out how that's going to work. You know what I mean?
I do. And I think the work that you're doing is really interesting. In fact, I guess the biggest challenges you've already laid out potentially. I mean, what are some of the other challenges in developing assistive technologies?
I think there's several. One is that the way that our payment methodologies, the way our sort of insurance set up is not really it's not really set up in a way that facilitates easy adoption, right? Like in order to say we can show all these things with robots, but then we have to go out and get FDA approval. We have to get the insurance companies to pay for it, right? There's all these bureaucratic hurdles to deploying this technology in real practice. And there's also a lot of inertia in the healthcare system. I guess the best way to say it, you have a lot of vested interest. And if you go in trying to change things, it's very difficult sometimes because you have a lot of things standing in your way. Healthcare, I've done it now for 15 years. I've been doing this. I was doing data science back before it was a word. Back in like 2005, 2006, I was building Bayesian networks inside SQL databases because we had no other way to do it. The only thing that existed at the time was like Weka. There was no Apache Spark. There was no Hadoop. Nobody's talking about big data. Back then, people just we were doing data science, but people just called us crazy, right? Like there was. You got to imagine this is like, going back 15 years. I mean, literally, like, it's weird to think about, but, things have changed a lot, but, there's still these barriers, I guess. And having done healthcare a long time, I've seen people deploy these kinds of technologies over and over, and I've seen them fail. And a lot of it at times, it has nothing to do with how good the technology does. It has everything to do with the sort of people side of the equation. And that's one lesson that I learned I learned a whole lot during my 20s and early 30s was how often the people part of it, if you don't take that into account, you will fail, and I see startups fail, technology startups fail all the time for the same reason, especially in healthcare where it's so regulated and there's so many vested interests. You really have to understand the people side of the equation. And, regardless how good your technology is. So.
Well, I really appreciate the work that you're doing, and thanks for joining us from your office in heaven. I know,
I glow. Look how bright my teeth are in heaven. I love it actually. Yeah, they give me an office in heaven. What?
Did you go to the Met Gala?
Did I have what?
Did you go to the Met Gala?
No, I did not. I did not get invited to the Met Gala. I asked. They said I couldn't come. Apparently, like Elon Musk got invited, but I guess I'm not to that level yet. Understandable. I am building a rocket in my backyard, but it hasn't gone anywhere yet. But one day. Well,
keep up the good work that you're doing. It sounds like I'm going to be getting Grandma a robot, and I'm excited about that. It's actually, if I can get a robot that's going to help my health, then I'll do that. So, if somebody wants to connect with you, Casey, if they want to find out more about the work that you're doing,
sure.
How can they do that?
You can find me on my website, caseybennett.com, or you could check out my company's website, which is Raiven, Raiven, Raiven Healthcare. And be happy to chat with anyone if they have questions.
Well, thanks again. And I appreciate the work that you're doing and that you shared some time with us. If you guys want to follow me and more of my interviews, you can do that right here on ZDNet or Tech Republic, or maybe go to my website at tanyahall.net. And there's links to all my social platforms, LinkedIn, Facebook, Twitter. In fact, if you want to talk to me, go to Twitter. I'm at Tanya Hall Radio on Twitter. I'd love to hear from you. Thanks for watching.